Assalamu alaikum and welcome again to the medical concept with Dr. Falak. Today we will discuss about the hearing physiology, especially the role of external ear and middle ear in the sound transmission. So by the end of this lecture, we all should be able to describe the basic properties of sound, explain the functional anatomy of the external and middle ear, understand the role of tympanic membrane, discuss the attenuation reflex, and explain the concept of impedance matching. So hearing begins when sound waves enter the external ear. These waves travel through the ear canal and strike the tympanic membrane, causing its vibration. These vibrations are then transmitted through the ossicles of the middle ear and reaches the cochlea. Within the cochlea, these mechanical vibrations are converted into nerve impulse that travels through the auditory nerve to the auditory cortex, where the sound is finally perceived. Hearing is essential for communication, for learning, social interactions, enjoying music, recognizing danger signals, and maintaining awareness of our surroundings. Even mild hearing impairment can cause significant impairment of the quality of our life. Sound is a mechanical longitudinal wave that requires a medium for transmission. As sound travels, the particle of the medium, they move back and forth and thus create an alternating region of compression and rarefactions. The pressure changes carry energy from the source to the listener. Then comes a wavelength. Wavelength of a sound wave is actually the distance between the two identical points in a successive cycle, such as two adjacent compressions or two adjacent rarefactions. Wavelength is inversely related to the frequency. So as the frequency increases, the wavelength decreases. Several properties define sound. Frequency determines the pitch. A high frequency sound produces a high pitched tone, whereas the low frequency sound produces a low pitched tone. Amplitude determines the loudness. Timbre gives sound its unique quality, allowing us to distinguish between different musical instruments. Duration determines how long a sound will last, while directionality helps us to locate the source of sound. Resonance refers to the amplification produced by vibration of the surrounding structures. Now this slide shows you the human hearing range that is limited from 20 to 20,000 Hz, that is between infra and ultrasonic sound waves. Normal, the conversational speech ranges between 300 to 3500 Hz, while average conversational speech intensity is about 60 to 65 decibels. Remember, the sound intensity greater than 100 decibels can damage auditory apparatus and produces severe type of pain. Now coming to the functional anatomy of the ear, you will find two pictures here. Okay, one is with the labeling, another without labeling. So ear is divided into three main structures: the external ear, middle ear, and the inner ear. External ear comprises of the auricle or the pinna, external auditory meatus, and auditory canal. It is separated from the middle ear by means of a tympanic membrane or eardrum. Inside the middle ear, you will find three small bony structures that are also known as ossicles, that is malleus, incus, and stapes. The stapes and malleus and incus are considered as the smallest bones of our body. The stapes bones ultimately opens into the vestibule by means of an oval window, and thus it's connected with the inner ear. You will find another structure, the tubular structure, that connects the middle ear cavity with the nasopharynx and is known as eustachian tube. Okay, you will also find some nerves and some blood vessels in the middle ear cavity. Also, two important muscles are there that are known as tensor tympani muscles and a stapedius muscle that have their specific functions. Later, we have an inner ear that is enclosed in the petrous part of the bony temporal bone. Here you will find the semicircular ducts along with their canals, and then the cochlear duct and the cochlear canal. Later on, they are connected with the brain by means of vestibulocochlear nerve. Now let's discuss the functions of external ear. The first is the auricle or the pinna. It's responsible for the connection and funneling of the sound wave into the ear canal. It also helps to localize the direction of the sound, and it also slightly amplifies certain frequencies that are important for speech. Then we have ear canal. It's responsible for conduction of sound waves to the tympanic membrane. It provides resonance and amplifies speech frequencies. It protects the middle ear from foreign particles and insects because there are certain glands, the secretion of which, for example, the ceruminous gland, they produce airwax. Airwax is responsible for the lubrication of the ear canal and it prevents dryness. Airwax traps dust, microorganisms, and debris, and they all maintain a suitable environment and provide antimicrobial protection. Now let's discuss the most important function of the tympanic membrane. Number one is the sound transduction. The vibration of the tympanic membrane converts sound waves into the air into mechanical energy and passes them to the ossicles. Second is the protection. Tympanic membrane acts as a barrier that protects the middle ear from foreign bodies, dust, and different type of pathogens. Pressure equalization. It works with a eustachian tube to equalize pressure on both sides of the tympanic membrane. If there is any trauma, infection, severe type of loud noises or sudden pressure changes, these all can cause rupture or perforation of the tympanic membrane that can lead to hearing loss, severe pain and discomfort, tinnitus, that is ringing in the ear, discharge that could be either serous or could be purulent, and sometimes this can lead to spread of the infection towards middle ear as well as the inner ear. In this picture, you can see here that this is the normal tympanic membrane and this is the ruptured or perforated tympanic membrane. So early diagnosis and rapid treatment helps prevent complication and protect hearing. Now come to the function of the middle ear bones or ossicles. Malleus and incus, they act as a lever system and thus amplify sound waves. Second, the stapes. Stapes causes the transmission of vibration to the oval window of the cochlea. Then we have two muscles, that is tensor tympani and stapedius muscle. Tensor tympani is attached to the handle of the malleus. It pulls the point of attachment and keeps tympanic membrane tense. While stapedius, it's attached to the footplate of the stapes and thus it causes its stabilization. While eustachian tube, it's responsible for the equalization of the air pressure on both sides of the tympanic membrane. It drains middle ear secretions into the nasopharynx and it prevents painful bulging during rapid external pressure changes. Now come to the most important exam concept, that is attenuation reflex. Attenuation reflex is also referred to as acoustic, tympanic or stapedial reflex. By definition, there is involuntary contraction of the middle ear muscles, especially the stapedius, and lesser so tensor tympani in response to loud sounds. Why we are saying stapedius muscle? Because the tensor tympani muscle is already in a state of contraction, so the role of a stapedius muscle is more in this reflex. As we are saying is this reflex, it means that there are three main components: sensory component, the central risk component, and the motor component. The sensory signals are carried through vestibulocochlear nerve to the center in the brainstem, especially the pons. From there, the facial nerve is carried as the nerve to the stapedius muscle and the tensor tympani, which causes the contraction of these muscles. The latency time is only 40 to 80 milliseconds, and this is a bidirectional or bilateral reflex. It means exposure of loud sounds to one ear can cause bidirectional contraction or bidirectional attenuation reflex. So what are the main important things that are going to happen in this reflex? The stapedius muscle pulls stapes outward and the tensor tympani pulls malleus inward. It means both of these will cause the contraction of these muscles toward inside or towards the middle ear, right? Ultimately, they will lead to increase the rigidity of the ossicular chain and thus decrease the transmission of low frequency sound that are less than 1000 Hz by 30 to 40 decibels. By doing this, it protects cochlea from loud vibrations. It reduces background low frequency noise, improving speech perception, and it also responsible for decreasing sensitivity to one's own voice. Okay. So this reflex acts as a volume control of the middle ear that automatically reduces the impact of loud or low frequency sound and protect the delicate structure of the inner ear. So in exam, you can be asked about the definition, its reflex arc, and what are the main important actions and what are the functions ultimately. Now coming to another most important exam topic, that is acoustic impedance and impedance matching. Acoustic impedance is the opposition offered by a medium to the passage of the sound. For example, sound, they are normally present in the airwave. They have to pass through the water in the cochlea. Okay, so the most important problem is that the sound is traveling from air with low impedance to cochlear fluid with a high impedance. So majority of this sound energy is reflected back while only few percent of the energy enters into the cochlea. So how the middle ear solve this problem? The problem is solved by means of impedance matching. And what is impedance matching? Impedance matching is actually when the middle ear converts the low pressure, large area vibrations of the tympanic membrane into high pressure, small area vibrations at the oval window of the cochlea. Okay, so it will lead to more sound energy enters into the cochlea. Thus, impedance matching allows efficient transmission of the sound from ear to cochlear fluid. Now let's discuss about the mechanism of impedance matching. The first is the area ratio. The tympanic membrane, here you can see, the tympanic membrane has a much larger area as compared to the stapes footplate. So the area ratio is 17:1, number one. Second is the lever action. The malleus and the incus, they act as a lever system which increases the force. And the third is the buckling of the tympanic membrane. The tympanic membrane is more compressed at the center and stiffer at the periphery, resulting in the buckling effect that further increases the pressure transmission. It means more and more sound waves will enter into the central part of the tympanic membrane, resulting in the buckling. So by means of these three, difference, the area ratio, the lever action of the ossicles, and the buckling effect of tympanic membrane, the impedance matching is going to compensate this acoustic impedance. Vibrations of the skull bones can directly stimulate the cochlea. In this case, sound bypasses the outer and the middle ear, and the vibrations are transmitted through the temporal bone, directly affecting the cochlear fluid. We have two types of conductions, air conduction and bone conduction. In the air conduction, the sound waves enter the outer ear, then middle ear, and the inner ear. And in the bone conduction, the vibrations directly pass through the bone and causes the activation of cochlear fluid. In this case, we have two important clinical tests, Rinne's test and the Weber's test. In the normal hearing, air conduction is usually greater than bone conduction. But if someone is having conductive hair loss, he will be having greater bone conduction as compared to air conduction. Now coming to the summary, functions of external ear is the collection of the sound waves, sound localization, resonance or amplification of the sound, protection of tympanic membrane and the middle ear, maintenance of temperature and the humidity, as well as antibacterial protection by cerumen. Then we have summary for the function of the middle ear. It's responsible for the transmission of sound vibration, amplification of the sound, and this is especially known as impedance matching, protection of the inner ear through attenuation reflex, equalization of the air pressure by means of eustachian tube, ventilation of the middle ear, drainage of the middle ear secretion, and filtering or reduction of low frequency sound. Now this was all about the role of external and middle ear in the hearing. Now we will be discussing about the role of inner ear and the vestibular system in our upcoming lectures. So if you are like this topic and if you have slightly understand something about it, do like and subscribe our channel. Thank you.